Hello, everyone. My name is Reagan Perry, and I'm so excited today to be sharing this community based approach to preventing gestational diabetes, a condition that affects many women and families. Together, we're going to explore how education, empathy, and community effort can make a real difference in improving maternal health. Did you know that millions of women worldwide face the challenge of gestational diabetes? It's a growing concern that affects not just mothers, but their babies too. Gestational diabetes, or GDM for short, is a significant public health concern. It impacts approximately 7 to 14% of pregnancies worldwide, which is a staggering number. And what's more alarming is that women with this condition, like PCOS, obesity, or even a previous history of gestational diabetes, are at even greater and higher risk. The health consequences are serious preeclampsia, cesarean births or a C section birth, and neonatal issues like hypoglycemia, which is low blood sugar. These are not just statistics, they are real risks affecting real women and their babies. That's why prevention is so crucial. After listening to the previous slide, there is hope. But with the right support and education, we can turn the tide and help women prevent gestational diabetes or GDM before it even starts. Our current situation calls for urgent action. Early prevention through lifestyle and dietary changes have proven to be effective, but here's the challenge. There are many underserved communities that often lack access to tailored education and resources which widens health disparities. In order to bridge that gap, this is where community nutrition programs can really shine by bringing knowledge and support directly into communities that need it most. The purpose of my study is simple but powerful. I want to evaluate whether community based nutrition education programs and workshops can truly increase awareness about gestational diabetes and inspire healthier eating habits among high risk pregnant women in Southeast Texas. Imagine giving women the tools they need to take control of their health earlier in pregnancy. What a difference that can make for their future and their baby's futures. You may ask, what is the literature telling us? Well, research supports what we already suspect. What women eat influences their gestational diabetes risk. Diets higher in refined carbs and sugars increase blood sugar levels, while fiber rich foods like vegetables and whole grains help improve insulin sensitivity. And education, it's powerful. When women learn about these connections and gain confidence in their choices, they're more likely to make lasting changes. Culturally tailored programs that respect traditions and community norms, they're even more effective because they speak directly to women in their everyday lives and their families. We're not just giving information, we're building skills, confidence, and community support to sustain healthy habits. So, what strategies are most effective? First, carbohydrate management. Choosing whole grains, reducing sugary snacks, and practicing portion control. Those are good. Those are just to name a few. Second, behavioral techniques. Goal setting, self monitoring, and problem solving. Those are the tools that help women turn knowledge into action. And lastly, community engagement. By bringing women together, involving their families, and respecting cultural food preferences, when we create programs that feel familiar and supportive, women are more likely to embrace these changes. Why? Why is this important? Well, we're reaching out to women who need us most by providing a safe space for education and support. This also helps the women build relationships and allows us to meet them where they are. Our target population, you may ask, who are they? Well, it's pregnant women between the ages of 18 and 40 and who are at a high risk for PCOS. Women who have a BMI over 30 and or who have a history of gestational diabetes with prior pregnancies. We'll reach them through local clinics in Southeast Texas with a special emphasis on the places they already visit and that they already trust. By measuring both what women know and how they behave, we can truly see if our program makes a difference. Our main goals here are to increase women's knowledge about gestational diabetes to help them adopt healthier dietary habits, like eating more fiber, controlling portions, and choosing better foods, and ultimately to reduce the incidence of GDM. We'll measure this through questionnaires and medical records, tracking changes from before the program and to after the program is over. Imagine a lively, engaging workshop, hands on, practical, and full of support that women can carry into their daily lives. Well, the intervention consists of 4 weekly sessions, each about an hour long. We'll cover key topics like managing carbohydrates, reading nutrition labels, and practicing portion control. These sessions will be interactive, filled with demonstrations from recipes and group discussions. Between sessions, we'll follow up with calls to support and motivate women, helping make sure they feel confident and supported every step of the way. Tools and methods. We will be using pre and post test intervention questionnaires to measure the changes in knowledge and dietary habits. Additionally, we'll be using gestational diabetes screening results obtained from the women's medical records between 24 and 28 weeks of gestation to evaluate the intervention's impact on their GDM incidence. This comprehensive approach ensures or establishes that we're capturing both what women know and how they apply the knowledge in their daily lives. Anticipated outcomes and why they matter. This isn't about numbers, it's about transforming lives, supporting healthy moms and their babies, and building stronger communities. Of course, we expect to see improvements in participants in their knowledge and dietary habits, especially in underserved populations. We're aiming for real, lasting change, better knowledge, healthier eating, and we can help them make a meaningful, sustainable change by reducing their gestational diabetes risk. This can also improve pregnancy outcomes and it sets the stage for healthier futures. The beauty of this is it's scalable. What we learned here can serve as a blueprint for communities everywhere by spreading hope and health far beyond Southeast Texas. So, here's to wrapping it up. Community-based nutrition education isn't just about giving information. It's about inspiring change, building trust, and making health accessible and achievable for every woman. At the end of the day, it's about empowering women through education and community support. Together, we can turn small steps into big victories, creating healthier pregnancy and stronger communities. Thank you so much for being a part of this journey, and I hope to see you next time. Hi, I just want to say thank you again for joining me on this journey and listening to this presentation. I look forward to working with communities, healthcare providers, and everyone committed to making this vision a reality someday, hopefully in the near future. That would be really cool if this was able to come to fruition. I learned a lot about gestational diabetes and how it affects women and families. And it has been a journey, and it has been a good one. And so, thank you for letting me share it with you. Below are my references, and have a good day. See you later. Bye.